Welcome, everybody. I can see some of you. Hope to see more of you soon. I'm Susan Reinhardt. I'm Senior Vice President and Director of the AARP Public Policy Institute and Chief Strategist for the Center to Champion Nursing in America, which is part of the AARP Center for Health Equity Through Nursing. So that's a lot, I know, but it's just great to have you, and congratulations to our 2024 grantee recipients. So joining me in my remarks, and you can see their pictures, this is Dr. Ashley Darcy Mahoney, who is the Senior Nurse Scholar in Residence at the Robert Wood Johnson Foundation. She's also a professor at George Washington University. And Vicki Good, Dr. Vicki Good, who is Chief Clinical Officer of the American Association of Critical Care Nurses. So welcome to both of my colleagues. I think you just heard Jennifer say that this is being recorded, and the recording is on right now. It will be available on our website, the Campaign for Action website, after the national press release is issued. So it'll come soon. As we're talking, you know the drill now. You use the chat function to share ideas, unless you just can't get it going, and then you just wiggle and wave and we'll figure it out. You can make comments, ask questions throughout the call, and during the designated question and answer period, we will answer questions posted in the chat or those that are raising their hand feature, or as I said, wiggling beyond control. We'll do that too. So to ensure the best audio, again, you know this, please keep your line on mute unless you are speaking. And again, welcome. We are thrilled to have all of you join us today to orient you to what we think a very exciting, I think record-breaking Health Equity and Nursing Innovations Nursing Fund. It's about nursing workforce and health work environments, and it's a grantee program. You'll hear more about it from many along the way. This program is designed and funded by AARP, the American Association of Critical Care Nurses, which is known as AAC and Critical Care, and that's where Dr. Vicki Good is from, and the Robert Wood Johnson Foundation, where Ashley will speak to her role in all of this thing. And the AARP Center for Health Equity Through Nursing is administering these roles. So we thank our funders very much, including AARP. AARP first recognized the need to strengthen the nursing workforce when we, especially for older adults, but for people of all ages and their families, when we created the Center for 17 years ago with the Robert Wood Johnson Foundation. It is a joint initiative of the AARP Foundation, AARP, and the Robert Wood Johnson Foundation. So AARP remains committed to ensuring our nation has a strong and stable workforce, healthcare workforce needed to deliver care for the 50 plus and their families. So that's all ages, really. Last spring, the National Council of State Boards of Nursing released new data, and I think most of you are aware of that now. It showed that 100,000 nurses left the workforce during the pandemic, and by 2027, almost 900,000, or almost 1/5 of the 4.5 million total registered nurses, intend to leave the workforce, threatening the national healthcare system at large if solutions are not enacted. So when that data came out, I got some shivers, and we said, let's see if we can pull together some of the nursing leaders and national workforce experts to help brainstorm ideas of what AARP can do. We are not the nursing home the nursing representatives or hospital representatives or any setting representatives. We represent consumers. So what can AARP do by engaging solutions to help mitigate the predicted shortage, which of course has huge ramifications for our members and, as I said earlier, their families, which is all ages. So from that meeting, this grant opportunity was jointly created and jointly funded, as I said, by AARP, RWJF, and the AACN Critical Care. So that was about a year ago. So just about a year later, we now have you and a dozen projects focused on innovative ideas for RN recruitment and retention strategies. So it takes a while, but you know, we had the idea, we got the funding, we had to work together with our colleagues here to co-design it, get the word out to potential applicants, get the applications in, review them. So all of that takes time. And I definitely want to thank Jennifer Peed, who really led our activities. And I know she'll talk about others that were joining her, but she really is the force behind all of this. So thank you. So Ashley, would you like to say a few words?
Yeah, I'd be happy to. Thanks so much, everyone, for joining today. So like we were just talking about a year ago, Karen Drankard and the incredible team at AARP and the Campaign for Action gathered a group of nursing leaders from hospitals, academia, frontline nurses, nurse practitioners together to really think and talk about the nursing workforce crisis. And nurses are the largest segment of America's workforce. They, for those of you here, are face-to-face with people that need help every day. And through a range of investments in nursing-related leadership, policy, practice, the Robert Wood Johnson Foundation is elevating the nursing profession by enabling nurses in the US to work to their greatest potential. And really over the past 3+ years, all nurses have suffered the realities of staffing shortages, poor working conditions, and continued trauma as a result of both the pandemic, but also this sort of staffing crisis in general. And so when we think about sort of next steps, it's up to lawmakers, healthcare executives, and nursing leadership, as well as frontline clinicians and folks really in the health system to ensure that solutions put forward are not only driven by nurses' experience, but also explicitly address the discriminatory policies that have perpetuated unsafe working conditions and systemic racism across the profession. And so I worked on the Future of Nursing report for quite some time, and the report, the Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, stated that nurses have a critical role in achieving the goal of health equity. But to take on the pursuit of that goal, we need robust education, supportive work environments, and autonomy. And our nation cannot address and dismantle structural racism or eliminate health disparities without partnership and innovation in nurses. And this is where you all come in. And I was so excited and grateful to AACN and AARP to really help us to delve through the many proposals we received for this application that support the advancement of one or more of the recommendations in the Future of Nursing report, aimed at really establishing and sustaining healthy work environments, which is exactly what AACN critical care nurses are all about as well. So I'm really grateful. I read through all of your applications. We know we had robust conversations with the team that read them. I'm so grateful to many of them who are on this call today. And just want to say thank you all for the time and effort you put in putting in these proposals, and really the innovative ideas that you have for thinking about how to create more sustainable and healthy work environments for nurses in an effort to advance health equity. So that's, those are my sort of words of excitement and advice, and really just sort of to get us going. And so at this point, I think I'd like to turn it over to Vicki Good and hear from you. So Vicki, I'll jump over to you now.
Thank you, Ashley. The American Association of Critical Care Nurses is honored to be a partner with AARP and Robert Wood Johnson Foundation on this program, really generating innovative solutions grounded in healthy work environments that address structural racism and really advance our RN recruitment and retention. For the last 20 years, or 20 years ago, AACN adopted healthy work environments as our priority advocacy issue. And based on that work, we defined in 2005 the healthy work environment standards. We continue to expand and lead work that helps to create healthy work environments across all of healthcare. And during the past year, AACN's National Board of Directors challenged our organization to go big with HWE initiatives. And boy, we have. We've launched 2 major programs and have collaborated in the grants program funding the work that you all are about to embark on. Last year, AACN funded and launched 70 unit-based cohorts dedicated to improving healthy work environments through the AACN Clinical Scene Investigator Program. And just last week, we launched a national collaborative of 44 hospitals working with implementation scientists to expand our knowledge about the tremendous impact of the health of the work environments. We have also created a new healthy work environment assessment tool to measure the healthcare team's perception of their work environment. As a part of AACN's collaboration in this grants program, you will be using this tool at the beginning and end of your projects to measure the perception of work environment. My colleague, Dr. Sarah Delgado, will demonstrate this tool later in this orientation call. Lastly, I just want to say congratulations to each team on this call. We look forward to your tremendous impact on our nursing workforce and the patients and the families that we all serve. Now I want to turn the call over to Jen to continue on our orientation.
Thank you, Vicki. I'm unmuted, right? Okay, good. So congratulations again. I'm really excited to meet you guys. I know we've exchanged a lot of emails and different paperworks back and forth. So I'm looking forward to this. I've been looking forward to this call. Congratulations again. My name is Jennifer Pede. I'm the managing director at the center here. And I just want to reassure you that we have a big team here ready to support you through your grant project. I hope you feel free to reach out to us anytime for questions you might have. We'll make sure you're connected with the right person. Your primary point of contact, who you may have spoken with earlier, is Nicole Harriman. She is our senior advisor, phenomenal project manager here on the team. She's on a well-deserved vacation right now, but she'll be back in early July and she'll follow up with everybody there. But in the meantime, any questions, always use that email address you've been using, healthequitynursing@aarp.org. So in addition to our program staff, we have an incredible experienced team of nurse experts, Ramon Lavandero and Sarah Delgado from AACN Critical Care, and we have Karen Drankard and Debbie Stamps with AARP. In fact, well, they're all on the call today, and you'll probably get time with them at some point. But I wanted to shout out to Karen, who really led our planning task force for developing this RFP, along with Ramon, Sarah, and Nicole, our project manager. So all the folks you see on the screen here are mentioned here. They're a resource for you. And just again, if you need us, healthequitynursing@aarp.org. So let's take a quick look at our agenda today. We wanted to start off with hearing from each of you. We'll just go in order by state. I'll help facilitate that, but a 2-minute or less description. And then we'll hear from our communications team about the national press release and some social media tools. Then AACN colleagues will demo how to use the HWEET tool. And then lastly, I'll just touch base on some ongoing communication and monitoring efforts. We're going to take questions from you at each section of the agenda. So, feel free to put your questions in the chat now, or, raise your hand or wiggle, as Susan said, and we'll make sure we get to you. So with that, I guess we'll just go in alphabetical order. If we could start with California's American Career College Educational Foundation grantee.
Hello, my name is Kim Cook, and I'm here with Jessica Carbajal from the ACC Educational Foundation. And American Career College and the ACC Educational Foundation have partnered with Greater El Monte Community Hospital on a 1-year pilot initiative to provide True Colors communication training to 130 nurses. The goal is to create a healthier work environment, enhance teamwork and interpersonal skills, and improve patient care through more effective nurse-patient interactions. This innovative program aims to strengthen the nursing workforce and address health equity in the diverse communities served by Greater El Monte Hospital.
Fantastic. Look at you, the leadoff batter. Great job, Kim. Thanks. Can we go to USC, Verdugo Hills?
Hello, this is Leah Gorgis. I'm the Director of Clinical Education and Nursing Excellence at USC Verdugo Hills Hospital. We've created the Safe Path Initiative to really look closer at workplace violence perpetuated by patients and family members. And so what we've done is really created a role-driven program that integrates insights from the community resource model, as well as our scope and standards of practice, to really create an environment that has robust security and responses, as well as a workforce that really understands their role when workplace violence takes place, as well as the support and ongoing support, as well as ongoing resources that the hospital provides to really enforce them, the support and the mental health awareness and support that we have. I'm sorry.
That's great. That's so great, Jean.
After workplace violence actually occurs. I just realized as I'm speaking that I'm on my husband's computer and it looks like my name is John, but
yeah. It came through as Jean.
Yes, Jean or Jean it's a French spelling.
Oh, okay. I thought you were saying, okay. And what is your name again?
My name is Leah Gorgis.
Okay. Thank you, Leah.
Thank you.
Great. Aiden, I'm wondering, the spotlighting isn't coming up. Maybe we could take the screen down so everyone can, get to know each other and see each other, and I'll just call out. Can we do that? The next one is DC Children's National Hospital.
Hi, good afternoon, everybody. I'm Cindy King, and my colleague Jill Porter is on the call as well. Our project actually focuses on the concept of commensality as a pathway to true collaboration and meaningful recognition, two of the components of the healthy work environment. And our rationale behind it is what we've found is commensality through the literature shows that the gathering of people to meet during meals is a historical and well-referenced strategy to build social connection. However, in our current work environments, that's something that's rarely done. And oftentimes we hear our nursing staff and others speak about not being getting time for a break or getting time to really connect socially. We also saw that the literature showed that loneliness increased significantly during the COVID-19 pandemic and has persisted. So we plan to do commensality groups amongst 3 different clinical units within our organization to see if purposeful gathering through commensality will support true collaboration and meaningful recognition.
Fantastic. Thank you. And Massachusetts, UMass Memorial Medical Center.
Hi, good afternoon. My name is Viet Lee, nurse manager at UMass Memorial Medical Center for the pediatric ICU. At current state, the PD ICU at UMass is going through a transition period for RN staffing. Our experienced nurses are retiring and is being replaced by a new grad nurse. Consequently, the night shift is oversaturated with newer nurse, but with less experience. Our goal is to focus on continuing education for new graduate nurse and to promote safe and high quality patient care. And this will boost the new grad confidence and lead to great job satisfaction and healthy work environment.
Fantastic. Thank you. Let's go to Maryland, University of Maryland, St. Joe's Medical Center Foundation.
Hello, my name is Liz Steer from St. Joe's in Maryland. For our project, our overall goal is to implement a systemized approach to nurse and team member well-being as part of our strategic plan. We're using the IHI's framework for improving joy in work to categorize our current wellness offerings, but it also acts as a continuous gap analysis that helps us identify where our biggest opportunities are. Through this system, we identified 3 areas to focus on for this project. One is real-time measurement. For that, we're implementing something called stress first aid that allows team members to understand where they are in the stress continuum. It creates a common language to identify those feelings, and then also resources to help work through that. The other 2 are participative management by focusing on wellness activities for our nurse manager group, and then equity and fairness, for which we are doing some regular educational opportunities throughout the year and educational resources for EDI matters.
Great.
Thank you.
Yeah, thanks, Liz. How about North Carolina? Do we have UNC Chapel Hill School of Nursing?
Yes. Good afternoon. This is Ashley Kellish. I'm also here with my colleague Julia Coyne. We're representing the University of North Carolina Chapel Hill School of Nursing. Our project is actually partnering with our medical center, UNC Medical Center at Chapel Hill, as well as Rex in the Raleigh area. And we aim to improve our workplace violence program that we have in place now. We will be working with a team of expert simulationists, education specialists, faculty, et cetera, in a really collaborative environment to develop some hands-on simulated based training using standardized actors to teach de-escalation techniques. We're really focusing on DEI and ensuring that we are using the Campaign for Action's Health Equity Toolkit in developing of these simulations. And our goal is to make something that's sustainable and can be shared, so that we will sort of pilot it with about 100 nurses and also nursing students. And then our hope is that we can build a toolkit for others to take on, since we know this is such a challenge across many hospitals. So really excited to be a part of this group. Thank you so much.
Wonderful. Thank you, Ashley and Julia. Oh, there you go. Now we can see each other. This is great. Thanks, Aiden, for doing that. Now we'll move to New Jersey, RWJ University Hospital Foundation.
Hi, Jennifer. This is Mindy. Thank you so much. We're so excited to be here and grateful for this opportunity. So our project is looking to enhance a program that we have had for some time, working with a local high school for students interested in pursuing work in the healthcare world. And so what we are hoping to do is to increase the number of Hispanic nurses that we can recruit in an effort to develop some more concordance with the population that we serve. The goals of this project or the methods that we plan to implement really are threefold. So engaging with the community, the students, families, and the community itself, the high school and local leaders. Working with our RNs that are here and providing some leadership opportunities, and then assigning these high school students with one-on-one mentors so that we can engage them in growing potential future workforce.
Okay, great.
Thank you.
And then the other New Jersey grantee, we have another one at University Hospital.
Yes, good afternoon, everyone. My name is Dr. Martha Lavelle from University Hospital.
Hello.
And, creating a systemic change in the nursing workforce, we understand, requires a multifaceted approach to address recruitment, retention, and the creation of a healthy work environment here at the hospital. So the project includes the implementation of stress first aid, and I hear that we are not alone in that project. We will implement stress first aid in a number of the units. So the project will include creating the stress management, the stress relief resources for the staff, continuing with a peer support project, having stress relief projects such as a lavender cart to address the stress management of the staff. We want to partner with many of our external resources so that the staff can have as much resources as possible to address their stress, because we do realize that this impacts our retention of staff here at the hospital.
That sounds great. Fantastic. All right, we're down to the last four. Ohio, the Health Collaborative.
Hi, good afternoon, everyone. Just a quick sound check if you can hear me.
Yes.
Okay, fantastic. Hi, I'm Tiffany Mattingly. I'm with the Health Collaborative. We have a couple of other Health Collaborative colleagues on the line with us today as well. The Health Collaborative is a hospital member organization that supports Southwest Ohio. And our project is really focused on our nurses within the Southwest Ohio hospitals. So we've developed what we're calling the Nurse Managers Academy, which will help prepare rising nurse leaders for a leadership role by pairing them with tenured nurse managers within the hospitals and providing a 12-month skill building and educational opportunity. The first 6 months is really didactic, and we're bringing in 2 contractors. One is the Leadership Acceleration Inc. We call them LEI, and they'll be helping us really focus on the development of nurse management skills. So understanding leadership strengths and styles. We'll be doing DISC assessments, performance coaching and feedback, team relationship management, inclusive leadership. And then towards the end of that 6 months didactic, we'll spend some time focusing with a nonprofit mental health and well-being organization here in Southwest Ohio that will really focus on the mental health and well-being of our nurse managers. Once that 6 months didactic is complete, we will then go into a 6-month peer-to-peer mentoring where we bring those rising nurse leaders and those tenured nurse managers together to really apply the skills that they learn in the first 6 months, learn best practices, what's working well on the unit, what's not working well, and continue to sustain and keep that knowledge alive and help apply it in real life. So that's the second 6 months of our program, and we're really excited to be here. So thank you for having us.
Great. Thanks, Tiffany. And Tennessee, Vanderbilt.
Good afternoon. I am Dr. Rolanda Johnson, and I have my co-director here, Dr. Mamie Williams, and we have Beth Sims here, who helps us direct our academies for diverse nurse leaders. Both of these, we run 2 academies, one for aspiring nurse leaders, one for emerging nurse leaders. And the overall goal of these academies are to decrease the disparities we see with diversity in nurse leadership.
Good.
And so our proposed project adds another layer to the academy where we focused on the environment. And so we are bringing in an expert on healthy environment to do a training for our attendees who are nationwide. And so they will have a 2-hour training, and then they are assigned a mentor in their home institute as well as a national mentor. And Dr. Williams and I follow them on a quarterly basis. Their projects will focus on some aspect of leadership development, but they will add a component related to healthy work environment. And we will assess the changes with the healthy work environment, sense of belonging, etc., pre and post implementation of the projects. And that's a summary of our project.
Wonderful. Thank you so much, Dr. Johnson. And on to Tennessee. I'm sorry, that was Tennessee, Texas, Houston Methodist.
Hi, everyone. My name is Imelda Oka, and I'm with Grace Delgado here from Houston Methodist West. We're part of the Night Shift Shared Governance Council, which we started a year ago. So our project is focused, we're very passionate about night shift, anything about night shift. We both have worked more than 28, 30 years of night shift in nursing. And our project is focused on drowsy driving for our night shift nurses during their commute home, and hoping to increase their safety awareness through safety interventions, through video documentaries, featuring nurses with real life experiences about drowsy driving, and testimonials from our police officer. Also, we're gonna have interventions, hoping we could have a mobile application for our night shift nurses that they can use, and other safety interventions, eventually focusing on the overall well-being of our nurses, night shift nurses. So we're hoping to target 300 night shift nurses in our facility.
That's fantastic. Thank you, Imelda and Grace. Good to see you. And Washington State Hospital Association.
Hi there. It's hard to go last after all of these fantastic projects. I'm Megan Herman. I'm a director of clinical excellence with the Washington State Hospital Association. We work with all the hospitals in our state, but about 45 of those are rural. So our project is to do a training for rural nurse managers and charge nurses to support their leadership skills. Our plan is to recruit those hospitals and nurses to participate, and then conduct a pre-assessment so that we can understand where their needs and gaps may be, and then tailor our training to the nurses who are enrolled in our cohort. But we are expecting that training to include things like leading for quality, management, delegation, communication skills, and of course, health equity as well. So we think that in training these frontline leaders to help them be better at their jobs, that will improve the working environment both for them and the nurses that work under them, and also increase retention and job satisfaction.
Wonderful. Thank you, Megan. It's so great to meet you guys and, to start the conversation with your projects. We'll get it. There'll be more opportunities to work together as a group. You guys, I can already see like a lot of synergies and overlap. So we'll get onto that in a little bit. I'd love to turn now to Mary Boyle, our Director of Communications at the Center, who will share a little bit about plans for announcing the awards.
Thank you so much, Jen, and congratulations to all of you. It's so interesting to sit here and get a kind of a first glimpse of everything you'll be working on. So congratulations. And it's the job of my team to work with you and AACN to help announce the awards and help you share word of your projects with, media and newsletters and other places in your community and state where you would where you would like people to know about this. And so I'm just going to tell you kind of what will happen, what we're planning. We're going to post a national kind of press release or announcement announcing that these awards have been given. That national release doesn't get into a lot of detail about the state level, your level, but we're going to be sending each of you basically a template for your own state release. And what that means is we'll send you something that kind of has all the background in it, and you just kind of plug in the who, what, when, where. And by that, I mean a few sentences that, you've all provided such nice kind of succinct descriptions of your project. There'll be a place where you can describe your project. There will be a place where you can insert a quote from, the appropriate person in your organization. And it seems like you are all at institutions of some size that I presume all have communications departments. I think the hope is that you would share this release with those communications departments, and they would also help push this out. We will also be sending you a social media toolkit, some suggested posts that you could post on LinkedIn, on Facebook, on Twitter, really any social platform that you feel comfortable. I'll put in a kind of a little personal plug for LinkedIn. I think this kind of announcement and content and thought leadership does really well on LinkedIn. So I would encourage you all to use your personal, LinkedIn platforms to share word of this. The timing of this, I'm going to defer to Jen as to kind of when exactly we are going to start announcing this. We do hope that you will let us kind of take the lead in making the national announcement before you start to share your state templates. And I think that you will probably be receiving those state template press releases, I would guess, within the next 5 to 6 days. So you can, put in the, find quotes and make the work to personalize that state template. And then you'll be ready to go. You can, sometimes we have in past years, we've seen people who, really push things out immediately. You can wait a little while. I think it's whatever works for you. We're just trying to give you the tools to make this successful.
That's right. Thanks, Mary.
Sure.
So as far as timing goes, you sort of alluded to that question. We wait until all 12 of you have all your executed agreements, and there's a couple that we're still, working through some edits. I'm really hoping that we'll get all the paperwork back from everyone this week and be able to say we're good, the cohort's ready to launch. And I know Mary and AACN and RWJ have already approved the national press release, so it's ready. The back end part's ready to go. As soon as we just get a couple more, the last 2 projects signed off on, we're good to go. So hopefully that'll happen this week. I'm ready to sign when I get them back. So it should be this week. But I mean, I look to you, Mary, as far as timing of the release. Like, we'll have the okay to release, but you may need a day or two to line up, or Tuesdays
Right.
might be better than Fridays kind of thing.
Right. And as soon as we have that, I think we'll probably be able to communicate with all of you and give you a better sense of, when you can be expecting to receive this state press release for you to tailor for your needs.
Great. Any questions? Anyone have questions on the communications piece? You can raise your hand or go in the chat or just speak up.
I see Jessica with her hand up.
Thank you. I can't see that.
Just a question on approval. So you mentioned being able to write a press release that you'll send, to us. So we would be in California. When we customize it and tailor it, will we need to send it back for approval? Because that was part of.
You don't need to send it back to us.
Okay.
I think you would just need to go through whatever approval process your institution requires.
Got it. Perfect. Thank you
for asking that.
Unless you're changing something that's on the template, like some of our hard text, but AARP has signed off on what AARP is saying and so forth.
Perfect. Thank you.
Good question. Any others? All right, well, there'll be more time for questions at the end on anything. So if something, just post it in the chat or raise your hand at the end if something comes. I want to now turn to Sarah Delgado. She, with AACN, will present the H-Suite demonstration. And for this particular section, Ramon will facilitate the Q&A as the experts here on this tool.
Thank you, Jen, and thank you, Ramon, for agreeing to facilitate. I do want to call out Jennifer is on the call also, and Jeremy, they're also members of the AACN team, so they may be helping with some of the questions. If you have questions that you want to put in the chat, that's fine to do as well. So I've listed, or we have listed, Ramon and I have listed on this slide, 7 steps to starting the H-Suite tool, and this is an assessment of the health of the work environment. We at AACN, in keeping with the great tradition of American healthcare, use a lot of acronyms. So we refer to HWE, Healthy Work Environments, as HWE to make it shorter, and we refer to our assessment tool as H-Suite. So, but that just is an acronym for Healthy Work Environment Assessment Tool, just to be clear. There are 2 versions of the tool, the team and the RN, and I'll get into more of that with the demonstration. I think rather than reading these steps out, the easiest thing for me to do is share screen and actually demonstrate how to follow these steps. But I did want to put these steps and the link on the slide because I believe we will be sharing the slides after the press release goes live. So I'm going to go ahead and share my screen, and I'd appreciate if you guys could tell me if this doesn't work. Is everybody seeing the AACN homepage? Oh, wonderful. Thank you for the thumbs up. Okay, so this is our landing page. AACN.org is the way to get here. The additional language up here at the top is because I'm in a test environment for this demonstration, but you can simply go to aacn.org to get to this landing page. And you can navigate to our Healthy Work Environment page by clicking first on Nursing Excellence and then just choose Healthy Work Environments in the drop-down menu. This takes you to a page that has a wealth of resources about our healthy work environment standards, including a separate page for each of the 6 standards, some of the research and the projects that we've done on healthy work environments. If you scroll down this page and continue scrolling, you will get to what we call the H-Suite, the Healthy Work Environment Assessment Tool. Now, as I said, there's 2 versions of this tool, the H-Suite RN and the H-Suite Team. The H-Suite RN was formerly called H-Suite 2.0. Some of you may have used this tool already if you applied for our Beacon Award, for instance, or if you worked with one of our CSI teams, you will have familiarity with this tool. The H-Suite RN is the same as the H-Suite 2.0. If you have used H-Suite RN already, that may be the right tool for you to use for this project. However, if you're working with units that have not used the H-Suite yet, it is best to use the H-Suite Team, because the H-Suite Team will allow you to distribute the survey to all team members and get a holistic view of the health of the work environment across all roles, not just nursing. So when you go to set up your survey, you're going to click the purple Start Now, and you're going to come to a page that prompts you to either sign in or create an account. If you have an existing account or membership with ACN, you'll simply sign in over here. However, you do not need a membership with ACN to use the HWEET. You can create an account at no cost, and that account will allow you to conduct the survey just as smoothly as if you were a member. So there's no reason to join simply for this purpose. If you click create an account, you will be prompted to do so by entering your name, your email, your phone number, and some other very simple demographic information. Now, to note, we do not use your phone number for anything other than to verify that this is a unique account. We're not going to call you or sell your phone number to anyone. You can use your work number if you want. It's just to verify that it's a unique account. Be sure when you enter the email address that it is an email address you have access to, because once you create your account, the first thing that happens is you get an email to verify that it really is you trying to create an account. So if you're at work and you don't have access to your personal email, don't put your personal email in there. Make sure it's an account that you have access to at that time. So I actually do have an account. This is the test account. So I'm not going to create an account now. I'm just going to log in here, and this will go to what you will see after you create an account. So we call this next page, is it spinning up there? Oh, there it goes. Okay. So we call this next page the overview page. So this is where this is your sort of starting point for developing the HWEET team surveys. You'll see here we emphasize that the final report on the survey will only be available if more than 5 people respond, and that is to protect anonymity. With fewer than 5 responses, it's possible to trace the answers back to specific people, and that doesn't seem fair. So we require a minimum of 5 responses in order to generate a report. You also see on this page that this tool is really developed for a single unit. So for some of these projects, you're going to be opening multiple versions of the HWEET, or you're going to be working with managers. So for instance, the Nurse Manager Academy, you may be working with managers who each open a separate survey for their unit. But this tool is intended to assess the work environment on a single unit with a healthcare team that collaborates on patient care, just to be clear about that. On the right-hand side of this overview page are some key resources. The first one, assessment questions, allows you to download a PDF of what the survey looks like, so you know what questions the survey is going to ask. The second one is a sample report, and then there's some troubleshooting and frequently asked questions documents to support your use of the HWEET tool. So the next step in developing the tool is to click on Get Started in the gray box. You'll notice that as you're developing your survey and coming back and getting the report, this gray box is kind of where all the action occurs. This is where you make changes and where you access different things. So the gray box is important. So you're going to click Get Started, and then it's going to prompt you to find your organization based on geography. So we live in the United States. I live in California. I'm going to choose Anaheim because that's where Disney World is. Oops, clicked on the wrong one. Okay, there we go. If your organization, and this brings up a list of hospitals in that city and state. However, if your organization does not come up in this list, you can add it by clicking Add New Organization down here at the bottom. We'll choose Anaheim General Hospital for this demonstration, and then I'm going to click Continue. So now there are units at Anaheim General that have used this tool, and I get those units coming up as options for me. But so for instance, Children's National, if some units at Children's National have already done the tool, but they're not the units that you're working with on your project, you'll want to add a new team. So we're going to add a new team here, and I'm going to say we're working with Progressive Care Unit. And then the address you enter is just the address of the hospital. We said Anaheim, and there we go. Okay, so you enter all that information, add new team, and that takes us back to that overview page. But now you'll see a difference, and that is where it used to say unit name, it now says the unit that I've entered. So I know I'm in the survey for that unit. So if you're creating multiple units as a single user, what you're going to find is that you need to use these gears, the gear button. Hang on, I got to move this over. Okay, so this gear button next to the unit name is what allows me to switch between different units. So I can add a new, oh, it's asking for my organization all over again because I did that wrong. I'm sorry. So I can get a list of different units by, I can change to a different unit by clicking switch units here. I'm not going to do it now to save us time. So proceeding with this, now that I've selected my unit and entered that information, I have another get started opportunity here in this gray box, which is where, again, that's where the action happens. So I'm going to click get started, and then I'm again going to enter some demographic information. This asks for a little more detail about your hospital and your unit. So my facility is a community nonprofit facility. It is system affiliated. It's a very small hospital, or not very small, but it's a smaller hospital, 250 beds. So I'm just going to enter all that information. My unit is, let's say it's 20 beds. And then we ask about beacon recognition, which is AACN's award program, and magnet recognition, which is an award program available through the American Nurses Credentialing Center. So I'm going to say that my unit has not had that recognition, and my hospital has not achieved the magnet status as of yet. And then it asked about geography, you know, what kind of setting we're in. We're in a suburban setting here in Anaheim. So then I'm going to click save. And we go back again to that friendly overview page. And the action in the gray box now is to set up the dates of the survey. Now, the default here is a 1 month interval. So the system tells you to leave the survey open for 1 month. You can change those dates now. So either one of those dates. So suppose I'm concerned next week there's like a holiday, we have different staff working, things are going to be confusing. I'm going to start my survey on July 8th when everyone, you know, when my regular scheduling is happening. And I want to end my survey maybe a little sooner. Maybe I don't want to give them as much as a month. Maybe I only want to give them 3 weeks. So I'm going to click 1, 2, 3 weeks down. So you can choose those dates any way you want, any time interval that you want to choose. And then you click start assessment. And what pops up for you is the email that you can send to all the people that you want to complete your survey. Now, this is the email for that unit, for the progressive care unit. If I was setting up surveys for other units in the facility, I would have to start over again and get a different link and a different template. Does that make sense? Because you have one per unit. That you have one link per unit for the survey. And then you just click copy text and you can put it into an email and send it out to the staff that are going to be completing it. Now at the end, I'm going to stop sharing. Any questions while I'm still in the share screen? Ramon, were there any questions in the chat?
Sarah, there is one question. We were holding it till the end, but let's go ahead now. Megan is asking whether hospitals and units who are participating in the project to conduct the survey, whether there's any information they can be given about how AACN will use their data apart from this specific project.
The data is yours. We do look at aggregate data, but we do not identify it in the aggregate work that we do with this. So we wouldn't be identifying the results for your institution in any way. Does that make sense, Megan? And we
yeah,
can
that makes sense. We would just want to share before they do the survey, how that data is going to be used. So we can just share that. You only look at it in aggregate.
We only look at it in aggregate. So we have a plan down the road to possibly look at it for benchmarking and that kind of thing, but we wouldn't ever, look at it as your specific hospital. It would be in an aggregate form for that.
Thank you.
Any other questions that I can
Sarah,
navigate to? Go ahead.
There's two more questions that have come in. One is from Simi King, who says in the proposal, it was indicated that only RN outcomes were to be measured. And so they're asking if in the team version of the H-Suite, it's possible to measure RN specific data only.
So actually the requirement is RN data related to vacancy rate and attrition, but for the H-Suite, you can look at the whole team. You're not required to report out RN specific data for the H-Suite in the proposal that we put forward for this work. Does that help, Cindy?
Simi, is that work for you?
Yes, thanks for that clarification. I
Okay.
understood that. Thank you.
Sarah, next question is from Jessica Carvajal, who asks, when creating an account for H-Suite, we do that on behalf of the partnering hospital or the school institution providing the program?
Yeah, that's a great question. So I would say, I know that we have a couple of programs that are actually partnering with the hospital. So I think the best way to do it, if you're running a nurse manager academy, or if like the American Career College, you're working with another hospital, I would have the leaders that are in the unit create the survey. They're the best people to generate a strong response rate because they're right there with the staff. And that's really how we intended the survey to be used, by clinical leaders in, with the unit, generating momentum to drive survey responses. So that's how I would advise using it. If you have a nurse manager academy, for instance, work with the managers in your academy to do this with their units, and then to repeat it at the end and see what impact the academy had. I know that's challenging because you're here watching the demonstration, and those managers or the prospective members of your manager academy are not here, but we will provide the slides and this recording, and we'll work on other materials to help support their work in setting up the H-Suite. Like Ramon and I have talked about doing a short video or some kind of thing like that to help you spread the information they need. Does that help?
Jessica, you're nodding, so we'll take that as a yes. Great. Next question is from Imelda Oka in Houston, and that's the project, as I recall, that is the night shift project. So it's going across multiple units. Imelda's question is, if we have one person in charge per unit, how do we put together the hospital-wide results? Or is it better for one user to do the survey?
You won't have a way, so the reports that are generated are for the individual unit. We don't generate reports that cover the whole hospital. You'll be able to look, and I'm going to go over what the report's going to look like in just a second. You'll be able to line those reports up and get a picture of what the various units are doing, but the report will be per unit. It won't be for the whole hospital.
Imelda, does that cover your question?
Okay, yeah.
Yes. Okay, thanks.
Surveys per unit.
Next question, Leah Corcus, who has changed from her French name. Question is, how do you recommend surveying smaller procedural areas? For example, cath lab, GI, etc. Would they be separated by area or considered all procedural?
It depends on the number of staff you have there, Leah. So remember, 5 or fewer, we can't generate a report. So if you need to do aggregate because you're not going to have enough responses from doing individual units, then I would aggregate by procedure. As much as possible, I think it would be valuable to try to stay within the same service line. So if you have a group of cardiac procedure units or a group of GI procedure units or what have you, because some of this is about leadership, right? So if they have completely different, leaders that are supporting the staff in those units, it's going to be less useful data. So as much as possible, try to aggregate different units according to the structure of the organization and how the reporting is done. Does that help?
Very helpful. Thank you.
And finally, Kim Cook, it looks like your question was answered by some of the previous answers. Is that correct?
Yes, it was. Thank you very much.
Okay, Sarah, go
So
for it.
Aiden, if you can, thank you, Ramon. Aiden, if you can pull up the slides, I'll just do a couple minutes on how to get the report. So I don't have a screen that shows this, but when you, as the person who created and launched the H-Week, log back in after the end date. So remember the survey I set up, I said it was going to end on July 28th. If I log back in on July 29th, the screen is going to look like what you see here on the left-hand side. There's going to be a little blue get report. And that's how I'm going to get the results. So the results are, you get an email that the survey has closed, but you don't get an email with the results. You log back in and download the results from the gray box on that overview page. And then on the right-hand side is what the report looks like. And we have a visual way of reporting. There are means that are calculated and we provide those means, but we also use a visual to help you sort of get a quick glance what your results are. All the questions are phrased in 6-point Likert scale. So if they answer the two lowest Likert scale answers, that goes into the darker box. The middle two goes into the lighter box, and then purple means that they gave it the highest rating. So purple is either agree or strongly agree, or excellent or outstanding. So we kind of group the results into the 6-point Likert scale into groups of two to give the visual demonstration of the results. We, as a general rule, we say that if the score is over 5, you're looking at a very healthy work environment. If it's between 4 and 5, it's moderately healthy. There's things that could be done, but it's moderately healthy. Below 3 means that it needs improvement, and 3 to 4 is a somewhat healthy environment. And all of this is on the AACN. I just saw that question pop up in the chat. All of this is through the AACN website. So you're gonna log into the AACN website to do all of this work.
Great. I'm not sure if Elizabeth was asking, Claire, I posted, you can't see this, Sarah, but we're gonna post the H-Week slides to the campaign website immediately after the call, because I know this is time sensitive information, but we should include a link also to where they go to AACN to actually start the survey, right?
Jen, the link is also available.
That link is on the prior slide.
Right.
And then also on the prior slide is an email address, which is healthyworkenvironments@aacn.org. And that email you can use for any questions. We check it every business day. That email is checked. So we will check it and answer any questions or concerns.
Perfect.
Thank you very much for the time. I think Tiffany has her hand up.
I do. Thank you. I have some strange box in front of my chat, so I can't chat. So thanks for seeing my hand. So I have a quick question. With the Nurse Managers Academy, if each nurse manager on the unit is setting up their own account, do we have a parent account that will allow us to download those reports, or does each nurse manager or each unit need to download the reports and then send them to us? I'm a little confused how that works.
That's a great question. You will not have a parent account. They will need to share the PDF file with the results with you. So that's an expectation that you'll need to make clear to them as part of their work in the academy, is that they will download and share the report when they get it.
Okay, great. Thank you so much.
Sure.
Sarah, that answer, I think, covers a question that Jessica Carbajal asked. Jessica, is that correct?
Yes.
Okay.
Martha has her hands up.
Yes, I'm sorry. I think it just dawned on me. Each nurse manager has to create their own unit.
Yes, because you want the goal is to get a unique link for all the team members in that unit. So you'll need to do so each clinical leader who is involved in your project and working with the healthcare team on patient care delivery will need to get a link, establish a link. And the steps that I described for creating an account and putting in the demographic information will be needed in order to get that unique link. Does that help, Martha?
Yes. Thank you.
Tiffany, do you have another question? Go for it.
I did. So should we be consistent across all the units with which tool they use? Or if some units and some hospital, because we're working across multiple hospital systems and hospitals, if some are have already used the RN tool or the Teams tool, and then another, like, I guess my question is, do we need to just use one tool and stick with it? Or can we fluctuate between hospitals?
It's a great question. We would recommend using the team tool if the unit has never done this before. I don't think that you need to necessarily do the same tool across all the units. Like if you're, for the nurse manager academy, I don't think that's necessary. But you may want to be sure to identify what's what, so you don't end up comparing apples to oranges.
Yep.
Right.
Okay.
So the tools are incredibly similar because they're based on the 6 standards. So they're very, very similar. They will rate collaboration, communication, the 6 standards. What is different is whose perception are we gathering? So in the RN tool, we're gathering the nurse's perception of the work environment. And in the team tool, we're gathering everybody's perception, inclusive of team members who do not identify as nurses, right? So that's what the difference is. So I would just be careful about comparing across them because you will get different results, I think.
Okay, so I'm thinking some hospitals may have used the tool while others haven't, and they may have a preference that would be different than what the recommendation is if they haven't used the tool. One question about the PDF, does it come over labeled so we can easily identify which tool was used?
Let me pull up the sample report here. Yes, it does.
Awesome. That's great. Thank you.
Sarah,
I just wanted to double check. Sorry. Yes, it comes up labeled.
Sarah, to Tiffany's question, would it be useful if Tiffany were to download the questions for this for both of the tools, compare them, and then decide for the project whether you want everyone to use Team all the way across, or whether you want people who have already used RN to continue using that, just start a new team account? Would that be something to consider?
I think that's a brilliant idea. I think that's a great idea for everyone, for Tiffany and for everyone. You can download the questions. So if you want the team questions, you can use that right-hand toolbar that I showed you on the overview page. If you want the questions for the RN survey, open the RN survey and you'll have the same right-hand toolbar that you can use to find it's called assessment questions, and it's under resources on the right-hand side. That's a great idea, Ramon. And then you know what you're asking people, and you can sort of think through what the best tool is for you to use.
We have 2 more questions in the chat. Imelda in Houston is asking, do we need to do the survey based on our proposed project timeline, or can we push it back to prepare?
I think that's a question that I alone can't answer, because we need to think about that as a group, Ramon, with Karen and Jennifer, and consider how that works. We had SID in the project guidelines 3 weeks. But perhaps we can take questions about that offline. What do you all think?
What I'm wondering is if anyone who has questions about the timeline part of the H-Suite, please send in a question and let's look at each part individually, because doing a blanket answer might just become more confusing. So, Imelda, will that work for you?
I can't, my raise hand function doesn't work, so.
It worked.
Okay.
You just did it.
Well, my.
Analog.
I just have a quick question just about the survey, because we were planning to do pre-post surveys.
Right.
So if we're gonna do the team survey, then we would create one for each location and label it pre. Could we just label it pre in how we named the unit, or would it just identify it by date? I guess what's the best strategy that you've seen for people who want to do comparisons?
Just pulling up when you get that report result back, that PDF file that has your results, it'll have on there the date the survey was open. So you'll be able to know if it was a pre or a post based on the cover page of the report. Does that help, Simi?
Yeah, and is there any way can you get the raw data? Or is it only presented in this dashboard kind of, or this way? Like, can the person who's doing the survey, can we get our raw data if we wanted it?
That I don't know the answer to. I would suggest though, maybe taking a look at the sample report, because it does give quite a bit of data. Like, it does break it down by each item in the survey and give you the percentages and the mean for each and every item. So there's quite a bit in that report, but if there's anything not in that report that you want to know, let us know for sure. Okay, and we'll see. I only showed, when I showed you what the sample report looks like, I only showed the first page of it. It's a full page. It's much longer than that, and it goes through each item, if that makes sense.
Okay, Elizabeth has a live question, and then we have one more in the chat so far. Elizabeth, do you want to go ahead?
Yes, thank you. So if we already have a process for completing the healthy work environment tool, can we keep that same cadence if it's already part of our normal process in the hospital?
As long as that cadence aligns somewhat with the project. So the idea of using the H-Suite as part of the grant-funded project is for us to understand the impact on the work environment that the project has. So if the cadence is that you would do it, next June and you did it last June, then we might not be able to sort out the impact of the project. Does that make sense?
So if I have recent ones for all the units, we work on the project, and then the next one is we do it every 4 months.
That's fine.
Okay.
So you recently just completed it, basically.
Correct.
Yeah. I think we said in the application that if you were completed it in the last 6 months, that counts. Ramon, can you remind me, was it 6 months we said?
That's what I recall, but I think the basic point is that if you're close enough to it, then use those data, don't have people redo it, and then do your post. So, okay. Question from Jessica in the chat stream. Will the survey be open over the course of the grant period, or will it open and close during certain periods?
So
or can we set the dates to open and close?
So the last one, you set the date. The survey itself is a free resource that is available all the time from ACN. You can launch the survey anytime at all. You determine on that page that comes up after you enter demographic data. One of the gray box actions is to select the open and close dates of your particular survey. But in terms of accessing this resource, it's not tied to the grant at all. This is something we offer to everyone in our community.
Is there a
And to
recommended
Sarah's,
time frame? Like if you're if you're working with the hospital partner and you're saying, okay, you've got 3 units you're working with and they all need to put in the same time frame, right, to try and get these survey results. Is it 2 weeks? Like how long do you give participants to complete the survey? Like from an open
Our default is a month. And the reason we do that, Jessica, is that because clinical schedules are not 9 to 5, Monday through Friday, right? People work all different times. You have some people who only work weekends, some people who take a leave of absence, some people, and we really want to, the most important thing is to maximize the response rate. So that's we set the program to default to a month.
And we have some flexibility on that month, right? We can kind of, now that we know we can get started, we can kind of have flexibility on the start of the program. Okay, great.
Yeah, you have some flexibility. If there's individual questions about timing, I think we should take that offline, but absolutely there's some flexibility. And I would encourage you all, now that we've done this presentation, go ahead and take a look and download the resources in that right-hand column, look at the questions, look at the sample report, and start thinking about how you want to approach this. And then use that email address that Ramon put in the chat if you run into questions, because that is our helpline for the survey that we offer to everyone in our community. And also we have the AARP website also has a place for you to post questions.
Thank you.
I think I've gone over my time, Jen, and I apologize.
This is a really important part of the call. We predicted this would be the bulk of the call, so I don't want to rush people if folks have our last slide is quick. So if there's more questions, feel free to ask.
Jen, we'll add one more piece, which is picking up on Sarah's comment about the survey is always available. If as you start becoming familiar with the tool and start using it, you find that it might be useful for other hospital activities, other units, or anything like that, you're very welcome and very invited to open appropriate surveys and start using it. So this is not limited to this grant. The only limitation with the grant is when you do it because of the timing of pre and post measures.
Mm-hmm. To that point, it might even be interesting as if I were a grantee and I was thinking about this, if I was doing an intervention with a particular unit and I'm looking at the change in the H-Wheat scores, it might be neat to have a unit that doesn't get an intervention and just, for your own knowledge to see, wow, it really changed a lot in this unit and nothing over here. Maybe that's even more evidence that your intervention is helping create the change you want. Okay, so I don't see any more hands. I guess we can go over to the next slide. I just wanted to touch base a little bit on kind of give you a preview of what to expect with our year together. We're very excited to be working together. And, Nicole will, again, when she's back from her wonderful long vacation, it's a 4-week vacation, so I'm really missing her. But when she comes back, she'll communicate this to you guys and give you more conversation around it and dates and criteria and stuff. So don't feel like you got to take copious notes. I just wanted to give you an overview. So the H-Wheat and metrics that are required pre and post reporting, you will be asked, to share your H-Wheat scores, your pre-scores, and you'll be asked to report, in addition to the scores, the starting RN vacancy and turnover rates. Nicole will provide details, like I said, on how to report that, how to get that information to us. But we want to encourage you, if anything you walk away from here, is to get started on the H-Wheat assessment. That's kind of like critical. We expect the assessment, typically we expect the assessment tool to close, for you to close that in July. You have the month of July to get those scores in, but like we just talked about, if you have an issue with that timeline or a specific question, just email us and we'll try to help you through that. Additionally, throughout the program, we wanted to have quarterly check-ins, live conversations with the cohort. We're envisioning it just like this, a cohort, a Zoom call, a lot more interaction among you all. We're trying to set it up more like a learning collaborative. So, you know, you guys can share any challenges or victories, learn from each other, support each other. And we don't have the dates set, but we're thinking September, you know, a couple months once you're in and you got a feel for how things are going, December, March, and then late May, early June before the end of the grant and before you initiate your final H-Suites tool. So I just want to, you know, oh, and also the final annual report. There's one annual report at the end of the project. It's going to be a formal narrative report. We do know that will be due August 31st, 60 days after your grant ends. And it'll include the post-project metrics, the H-Suite scores, the RN vacancy and turnover rates compared to the pre-test. And there'll be some additional qualitative questions about your project, like, you know, the impact that was made, any lessons learned, sustainability plans, replication plans, any of that nature. Again, Nicole will give you the reporting template well in advance, so you'll have time to prepare for that. But I just, you know, I want to make sure you guys know we're a resource for you. Any questions during the implementation, just reach out. We're here to help. You guys are trying innovative things. We expect there'll be questions and bumps and hiccups and things you might not have expected. That's part of the beauty of doing innovative things. So don't fear us, call us, we'll help you. You met the nurse experts we have access to. So that's really a wrap for today, but more questions or comments, we're happy to, we have a few minutes left, we can take them.
Hey, Jen, I was thinking something. So all of us are always looking for examples of things that help to create healthy work environments. And you in passing mentioned that when Nicole gets back from her 4-week vacation,
yes,
she'll be in touch with everyone. But could you talk a little bit about what that 4-week vacation is about and
oh my
when
gosh,
she's able to take it?
Well, you guys might be familiar with this. It's a bit like a sabbatical, but one of the, you know, AARP, by the way, is consistently voted one of the top places to work. So we just got this new award for being a top employer, and the benefit package here is really nice. One of the perks of being an AARP employee is after 7 years of service, you're eligible for a one-time renewal. And you can take it anytime. You don't have to do it right at 7 years. I delayed mine for about 10 years. I just took it. Nicole has been here over 10 years. She just took it. But what it is, it's a one time, you get 4 weeks of leave on top of your earned vacation. So it's not, you know, you might earn 5 weeks a year after so many years, but now you get this 4-week block. You are unplugged. They give you guides on how to prepare for your renewal, what to do on renewal, what not to do on renewal. And you really are off. No one contacts you from the office. You unplug and you just take your vacation. You can do whatever you want. You can, you know, have a staycation. Nicole's off in Greece on a cruise with her family and her brother's wedding. And so it's very exciting, but it's just a nice way to refresh. And you come back with new ideas and new work norms, you know, new discipline. All of a sudden you remember the work-life balance you used to have after a 4-week break. So that's where Nicole's doing. She's taking her renewal. So she's going to come back ready and refreshed and eager to meet you all.
And that made Ashley Kellish's hand go up. Ashley?
I was offering a bit of applause for that wonderful approach. I've joked with our nurse managers about sabbaticals for nurse managers, giving them 30 days to go and refresh. And so you guys are living it. And I just think more people need to take action in that arena. So thank you for telling us that it can happen.
Oh, yeah, it can. And, you know, if anybody wants to try to learn about it, we can connect you with the HR folks. how they got it done. It's been, I believe years ago, people would get it every 7 years, like you'd requalify, and then they were like, no more. There are too many people in the workplace. They were staying and all trying to take renewal at the same time.
If Vicki Good were still on the call, her DNP project was to design a complete plan for nurse sabbatical. So anybody who has any questions about that, drop an email, send it to the the HWE email address, and we'll pick it up from there if anybody wants to know more about the idea. Tiffany?
Well, I love that story. Thank you for sharing. I think that there's really something to be said about that, like that coming back refreshed with a better perspective of the work-life balance. It's kind of like, that kind of slowly, when you put a frog in boiling, you slowly boil. So like, right. And you just start adapting under more and more stressful situations. And so swinging the pendulum in the other direction is a fantastic way to recalibrate. So thank you for that. Quick question about our opportunities to connect with others on the line. So the other states and will we get a distribution list? Will there be any formal opportunities for us to come together and hear how things are going or learn from each other?
Well, we do have the quarterly calls.
Okay.
Maybe we can set up, I'll talk with Aiden. I don't know if Aiden's still alive, but maybe we can set up like a listserv and, then it's like easy access, and then you guys can exchange your information. If, I don't want to get it, I'll have to get into all the privacy levers to share all this personal information and have you guys sign off on waivers. But maybe if we all subscribe to a listserv, then it's a learning collaborative, and we could do it that way.
That would be great. Thank you.
So it looks like it's time for the closing prayer, Jen. Go for it.
That's it. I just thank you all so much for joining us today. Aiden will get the HWEET slides up on the website today. And Aiden, I don't know if you're still on, but if we could send that link, we'll make sure we'll send it out to you guys so you have a direct link to it. But in the meantime, any questions, you know where to reach us. Thank you.
Thank you.
Thank you.
Bye-bye.
Thanks so much.
Thank you.